Hello, everybody. My name is Gary Baumgarten, but I expect you already know that, and I welcome you to this discussion on Facebook Live, paltalk.com, and on YouTube. You know, we all know that the COVID-19 pandemic that the entire globe is going through has changed things, and many things may be irreversibly changed. But in some respects, it's offered us an opportunity to go back to the future or travel back in time or whatever, because there are a lot of couples, a lot of mothers who are concerned these days about giving birth in hospitals because they don't want to expose themselves and their babies to the COVID-19. And in fact, in most hospital settings today here in the United States, the husband or the partner may or may not even be allowed to attend the birth. And for sure, the immediate family, they're not allowing into the hospitals any longer. And there is a renewed interest in midwifery because midwives used to be the norm. People used to give birth at home, not in hospitals. So I thought it'd be great to invite to us the president of the Midwives Alliance of North America. And she's going to tell us all about the trend back. Dr. Sarita Bennett, welcome to this discussion on Facebook Live, paltalk.com, and on YouTube.
Thank you so much for having me today.
Great to have you. So I presume my premise is correct. There is a trend back to midwifery.
Yes, that has been happening for a while, actually, that there have been more and more people choosing out-of-hospital birth, especially birth center birth. And I will say that the changes brought about by the pandemic, including some of the hospital policies that people find restrictive, are pushing people who were already considering it into making that choice. As well as there have been some families that really just are choosing it more as a way to escape hospital possible exposure to COVID. And we're seeing that really across the country. I can't tell you that anybody's tracking exact numbers. I'm sure we'll be able to do that soon as we see birth certificate data. But overall, all of the midwives that I'm hearing from and I'm in communication with, including myself, are seeing an influx of people that are really interested in learning more about out-of-hospital birth. Actually, or what we refer to as community birth.
Actually, if you stop to think about it, even before the COVID, people sometimes don't consider this, but whenever you go into the hospital, either as a patient, as a staff member, or a visitor, you are exposing yourself potentially to a lot of germs. They have people who do nothing but try to fight the germs, but as we know, now we're all a little bit experts on all this. Germs are invisible. You have no idea when you touch a surface, even before the coronavirus, whether you're picking up something that might make you ill. I presume that's something, at least if you're giving birth in your home environment, there's not the introduction of germs from the outside. There may be germs from family members, but there's not this constant influx of people coming into the environment. And perhaps it's I don't know, maybe it's even more sterile if you're cautious about how you do it at home than in the hospital.
Correct. The first thing to understand is sterility is an illusion. And even in the hospital, when we say sterile, that sterility doesn't last very long. And you have to be very, very careful. One of the reasons that people have been choosing home birth for decades now really is that it gives them more control over the decision making. It gives them more control over who comes and goes, who's they're exposed to. And all of that decreases the possibility of contamination with even antibiotic resistant bacteria like MRSA and other types of superbugs, as they're called today, to say nothing of viruses and things that we don't have immunity to.
Well, Dr. Sarita Bennett, you grew up, as you told me before we went to air, in West Virginia, in a very rural area where there were no hospitals in close proximity. It wasn't the case where you could say, honey, my water broke, and he's going to get her to the maternity ward on time. So midwifery was the norm back in the day.
Correct. As I was saying, back in the 1920s, whenever midwives were required by law to register over the next year or so in West Virginia, over 600 women came forward, and they knew that wasn't everybody, to register as midwives. It's really quite distressing then to have seen those numbers dwindle over the years, so that by the time I came along and I began practicing late 70s, early 80s, there were only about 12 of us that were doing out-of-hospital birth in the whole state. That really does take the control away from the community, away from the family. When I had a family practice clinic in West Virginia, which I did, I went to medical school after being a midwife for several years. One of the things that grandparents loved was that their grandchildren were born in their community rather than having to leave and go across the mountain, which was all the hospitals with OB units were at least an hour and a half away. So it really kept that sense of community at home, and it was something that was a source of pride.
So from your description and from my reading and preparation for this interview, Dr. Sarita Bennett, the accessibility that people have to midwives might depend on locale and might also depend on their financial ability to retain the services. Do insurance plans cover midwifery as they do in hospital births?
Not usually. It really depends on the state. It depends on the insurance plan. But overall, especially certified professional midwives, which is the type of credential I hold, which is the only credential that is specifically for midwifery at home or out of the hospital. Very few insurance companies recognize those, and the priority of an insurance company is to make a profit and to keep the money. So there's always lots of ways that they can find to not pay us. Even as a physician, they don't want to pay me for out-of-hospital birth or birth center birth. No one can really understand that because we save them lots of money and our outcomes are good. We have good statistics to show that based on valid data rather than just birth center data or birth certificate data. So there's no logic to why insurance won't cover hospital and birth center birth.
Yeah, I think probably now, and I'm just projecting, and you can correct me if I'm wrong, because of what I described in the introduction, where family members are not allowed, maybe even the father of the child may not even be allowed at the birth. And these days, we've changed our view of all of that. It used to be go boil some water, get out of the way with the dad. Now the dad is very much a part in many cases, probably in the majority of cases of the birth and the birthing process. And women don't want to be alone. They want somebody there holding their hand through the process, not just somebody who's popping in and out of the room periodically to check the cervix. They may be very nice caregivers and all, not saying no, but it's not the same kind of thing. So I'm wondering whether, because of the COVID, whether people are turning to midwives to be with them, even if they have an in-hospital birth, and whether or not the hospitals even allow for that.
Hospitals do allow certified nurse midwives to practice if they have obstetrician approval. They have to practice very much often by the same protocols that the obstetricians do. So that also doesn't mean that you can have your family members with you, or it doesn't really change anything other than you have a little bit friendlier face at the bedside. One of the things to understand about birth is that it's not just a mechanical process, and a lot of it depends how well it goes. Not only depends on the health of the mother prior to the birth, but it depends on how safe she feels, including comfortable. That's why it's a little more than just having your hand held. It's really about knowing that you've got somebody there who is your advocate, your witness, who's there to do what you ask them to do, as opposed to somebody who's there to carry out the protocols of the hospital. We mentioned earlier, you and I talked about the word doula, which a doula is a non-medically trained person to basically be a witness and an advocate for the laboring woman or person. And it's interesting that having that witness there, who is purely there for the well-being of the client, of the consumer, is the only intervention that's been shown to improve outcomes within the hospital setting. So it's more than just helping her feel comfortable. It actually improves outcomes.
I know here I live in New Jersey, the governor has decreed the doulas are essential workers, and they are being allowed. This probably varies from state to state, but they are being allowed in the hospitals. We have a comment from our Facebook audience from Ren Froman, who says, I'll take a midwife over an OB every time. They work with women and their bodies in a way that OBs don't. Would you agree with that?
Completely. And I really bring this back. I try not to get too wrapped up in home versus hospital, doctor versus midwife. And I really like to bring it back to model of care and who's in charge and who's in the center of the decision making. Very much within a high volume, especially hospital practice that is controlled by the insurance industry and the corporate business model, we really don't have the luxury of treating people as individuals, as opposed to midwifery, especially outside of that hospital facility, where it's a little bit more like a gourmet meal as opposed to a fast food meal, because we can focus on the authority and the autonomy of the consumer such that they are the driver of the decisions and can be considered as individuals rather than just a group of people moving through the practice.
You mentioned, Dr. Sarita Bennett, that the outcomes are very good statistically and anecdotally when it comes to births at home. But what about, and I'm sure this question is asked all the time, emergency situations? One would think that if you're at the hospital and God forbid there's a problem, an umbilical cord wrapped around a neck, for example, of the baby, a need for an emergency C-section, all of that is right there at immediate disposal of the medical personnel. What happens when that occurs in the home setting?
Well, the best news is that within the midwifery model of care, we don't do anything to increase the possibility of those things happening. For example, using medications to induce or force the labor. We know that all of those things that are done routinely within the hospital walls make the outcomes riskier and worse for both mothers and babies. A lot of people don't understand that when you look at the statistics for the United States, we are not the leaders in terms of optimal outcomes. The only thing we're number one in is cost. We're actually the only high resource country whose maternal mortality rate is rising. We have the highest first day infant mortality rate of any other high resource country. So the first thing we have to stop and realize is that we really haven't improved much with all of the interventions that are now considered normal and routine. So the first thing is, because midwifery care focuses on optimizing the mother's health prior to the birth and risking out people who would be better served within a hospital where you do have more medical technology, what we have within the midwifery community who we're serving overall are people who are healthy and who have the optimal chances of having a good outcome. So that's the first step. We improve the mother's health. The next step is we don't override her instincts or her body's signals to us in what it needs. We don't force people to maintain restricted activity so that we can monitor them. They're up, they're moving, they're active. And we are very well trained, and I teach midwives all the time, we are very well trained not only to prevent those emergencies, but to recognize and resolve them quickly. I've trained at both and practiced both at home and the hospital And I've seen way more emergencies in the hospital caused by those interventions than you see at home. The number one reason for transport from across the country, and my practice reflects that as well, from home to a hospital setting is maternal exhaustion, which is not an emergency. Most of the time, the mothers walk to the car, and we all would go to the hospital together because she had, for one reason or another, finally gotten to the place where, to prevent complications, we knew that she needed to be able to have some interventions. So you can't really compare the two models of care because they're based on very different philosophies. The other thing I'll say is that a lot of times 50% of babies have cords wrapped around their necks. That's a fallacy. And you don't get into troubles with it if you're not inducing labor and you're not breaking the water bag artificially, because that helps protect the baby. So a lot of the things that we've learned to be afraid of really are not things worth being afraid of if we're not interfering and disturbing the process.
So if somebody is watching or listening and is interested in exploring the possibility of home birth, maybe they're early in their pregnancy and it's a good time to look at that, especially given the pandemic, what resources can you point them to?
Well, it really depends on where they live and what options are available to them. There are plenty of people who don't have midwives to access in their communities, either because of legal status or just the fact that there's no one that is close by. You know, a midwife is, in many places, hard to come by. I used to drive 2, 3, up to 4 hours to help take care of people in the mountains because there just weren't other options. And that's not really the best way to go about it. If they are interested, they can contact a midwife in their local community. You can often just Google midwifery in your community, and you'll come up with names and birth centers. The Midwives Alliance of North America has a consumer website called Mothers Naturally. It's mothersnaturally.org. And there's a Find a Midwife directory where we've listed members' contact info that have allowed us to do so. I always tell people if they don't see anybody that's in their community, then talk to the midwife closest to them that they do see on the map, because it's a small, small world and we all know each other. And there's always ways to be able, if you want it and you're willing to look, then there's always a way to find a midwife.
Dr. Sarita Bennett, who heads the Midwives Alliance of North America. Thank you for your time. I hope this information was useful to people, and people have to make different kinds of decisions today that they weren't forced to make last year, way back last year.
Everything was different.
You didn't have to make. Now they're different. Do you go into that restaurant? Do you go to that party that you've been invited to? Do you have friends over? Do you stay isolated? You have to weigh the pros and the cons. And I think you've probably helped people who may be in a position, people who are pregnant or thinking about becoming pregnant, think about some options. Thanks for doing it.
Thank you so much for having me. There's lots of good resources. All you have to do is Google it.
And everybody, and Dr. Bennett as well, stay safe. And as I like to say at the end of these discussions, peace out.
Thank you.